If you aren't happy with the way you look, it can affect all aspects of your life. But now, thanks to advances in cosmetic procedures, you can diminish the signs of aging and restore your natural appearance. Dr. Beth Collins owns a practice in Guilford and is a double board certified plastic surgeon in general surgery and in plastic and reconstructive surgery. Thank you for being here. You're going to tell us all about surgical versus non-surgical facial rejuvenation.
Yes, I am.
This is great because depending on how much work you might need or how long you want to be out of service, you have lots of options.
Right, there are, and you know, coming up into what we have now, there are a lot of options, and it gets confusing for people. So I wanted to just give some idea of what's out there, because some people come into me and they want very minimal downtime. Right. They want to get back to work in a week and not have a lot of swelling and bruising. So in those people, they may fall into a category where just a simple injectable and non-invasive type of procedure goes, and there's a lot of really good options out there for them.
Pros and cons, though, with everything, I would assume.
Exactly. So those things, they don't last as long, and the effects of them are not quite as profound as if you go into the surgical category. And then there are people who really aren't candidates for injectables and won't get the result they want. You need to have somebody who's telling you you're not a good candidate for this. Yeah, you really ought to go into something else, and that's where, you know,
the professional comes in, right?
Exactly.
Let's start off with facial rejuvenation.
Okay.
What is this about? This is injectables.
Right. Well, no, facial rejuvenation just means making your face look younger.
Okay.
Whether it be doing it with injectables or doing some sort of surgical procedure, working on the appearance of your skin, all of these things in combination go toward the same goal, make you look younger.
All right.
So, yeah, so if somebody came into me and they said, I want to just, I look a little bit tired, people are telling me that, you know, I don't look so good.
I'm droopy.
I'm droopy, but I work a lot and I can't take a week off to recover from surgery. What can I do? I'll look at them, and if they're a good candidate for an injectable, we'll go there. And I think I have some examples of people.
Yeah,
that,
we could put up some before and afters here.
So this is somebody who just felt like they felt a little bit tired, and what I notice is that the cheek area is getting a little bit flattened, and the folds by the side of her nose are getting deeper. So she had some injectables and some Botox, and a very subtle result where people would say, "Oh, you look great. What did you do something?
Vacation.
Did you go?" So it's not something that's really profound. She was back at work within a week. The only major risk of this is just getting a little bit of bruising, and you know, that happens sometimes.
And I want to ask you, injectables, what are we injecting? How does this work?
So we use all sorts of different products out there. It's probably a big subject to get into, but some collagen type substances. And what they do is they could push fine wrinkles up from below and volumize, like if you have flattening in your cheek area or things like that, or a deepening of the creases by the side of your nose, it pushes that up and gives you more volume.
Got it. All right, let's continue the before and afters.
Yeah,
we have so many of them.
This is another who just had an injectable treatment, just was a little bit concerned about looking tired. And she also had a facial at my spa, and you could see just a combination of those light interventions, and you get a really profound result. So
we're talking like 8 years off this woman's life, it looks like.
Yeah. So
not her age, not her life.
Right. So those are some examples of what you could achieve with injectables, and there's a whole lot more on my website. And you know, you come in and I do a consultation with everybody and talk to them about what would be the best approach. Now, there are people who are
not candidates
really not
for that,
candidates
right?
for it. You know, you could always get a little bit of improvement, but there are some people who I will say you really would be better off if you did something surgical. So I have a couple of examples of people who their problem was not necessarily volume, but there was a lot of extra skin. And here this man has quite a bit, as you can see, has quite a bit of extra skin under his eyelids. And he actually had a problem where he was getting dry eyes. So with a lower lid surgery, just removing that extra skin. And there's another view of him from the side where you could see it really takes a lot of years off. So that's a little bit more downtime, a week off of work from that, because you do bruise a little bit and the swelling takes a little time to go away. But another one example I have here of a woman who had similar procedure, upper and lower eyelid surgery with a mid-facelift, and you could see that that flattened out those creases, got rid of that extra skin, and really took years off her. Now, the benefit to going through a little bit more surgery in these cases is that this result really resets her back and resets him.
A couple years, right?
Exactly. So he's back at 10 years younger, and he will age again, and you can't stop that progression, but it really resets you back to a time before.
I love that. We have one more set of pictures. I think this is more of an intense procedure.
It was. Now, this person went through basically everything. So she had an upper eyelid, lower eyelid, mid-face, and lower facelift with fat injections to her lips with a chemical peel, actually, to improve the skin. And there's her before and after. Now, that was quite a bit of surgery to go through, a lot more downtime, but you could see really, that's where you see before and afters that people talk about on television, where you get this profound result. And there's a picture of her out and about. Yeah, and I always joke she's 150 years old. She's 63 years old, and you would probably put her in her late 40s or early 50s,
absolutely.
I think. Yeah. So
well, it's wonderful that there's so many options here.
There are.
For really whatever you're looking for. If you want something minor or obviously a little more invasive.
Yeah, just depending on what you're willing to go for. And it just takes coming and having a conversation with me, and I'll be very honest and give all sorts of options with, and we always come to a decision together, what's right.
All right, let's put some information up on the screen. If you'd like to get a hold of Dr. Collins, she's located in Guilford, 203-689-5295, or check out the website at bethcollinsmd.com. Of course, you can see more pictures there. Dr. Collins, always a pleasure.
Thank you.